thinking that's very important to know. Okay, now we're going to talk about selling and marketing. Very, very good and fun part. We want you guys to know this, that a lot of people have this stigma against selling. And when we ask a person, all right, tell me and describe to me a salesperson, most of the time is people associate salespeople with actually negative stuff. They start thinking those sleazy car salesmen, those pushy phone operators that's trying to make you buy things in the phone. Okay, so we always think about the bad aspects of selling, but this whole world, the whole universe cannot function without salespeople. That any given time, people are selling you something. If there wasn't good salespeople, will you be wearing clothes right now? Will you be wearing the right clothes? Will you have that beautiful house, or will you have that nice car? Eventually, people that really help us are salespeople, but we always attach negative aspects to salespeople. And everything that we do in life, we're selling. There's a book by Daniel Pink that really, really talked about it a lot, that really made an impact for me, was that he talked about to sell is human. And whether we're selling a commodity, whether we're selling our services, whether we're selling a car, or whether we're selling appliances, we're selling something. Parents are selling to kids the idea that they should be good, the idea that they should actually listen, that they should eat what they are given in their plates. So anything that we do is some form of selling. Another thing also in the healthcare industry is that we frown upon the word marketing. And a lot of people says, you're not marketing your home health agency. So you don't want to hire a marketer. You want to hire a liaison. You want to hire a community outreach director. You know, they have all these different positions, names of positions, yet it means the same exact thing. You are a salesperson. You're selling a product, which is you and your company, and you want them to buy from you and use your product. So the sooner we agree, the sooner that we can get it in your head that you are selling and it is not a negative thing, the easier we can move on to the next level of success. So I want you guys to understand that. And what I want you to do is I want to be able to give you guys some aspects and takeaways and some advices in regards to what are great marketers. So look, as an agency or as a marketer for an agency, what 3 things did you do this week that got you a referral? Name them for me and make a comment, okay? So I want you guys to think about what have you done this week alone that is going to get you business. Now, there's going to be some people here that says, well, Michael, we haven't really started our company yet. We're in the beginning process of our company, so we're not really thinking about marketing yet. I want you guys to reverse your thinking and start realizing that just because you're waiting for your license, just because you're waiting for a few paperworks, that doesn't mean that you don't start marketing your company. Are you guys on LinkedIn starting to link in with people? Are you actually going to networking events already to start, at least meeting people and creating relationships? Are you scouring the internet and grabbing information of the people that you want to talk to? Are you gathering all the names of the doctors that would be potential referral sources? Are you starting to map out your visitation routes for these places? Have you actually gathered the addresses, the emails, put it in an Excel sheet, and started making your labels? Because eventually you're going to have to make those to do mailers. So just because if you tell me and you give me an objection, you say, Michael, we're just starting off and we haven't things straight on out yet, and we're going to do that eventually once we have our license. No, start now, get the small stuff out of the way, and start winning. Now, for you guys who's actually been working already, who's had your license, but want more success, what have you done this week? 3 things. Have you called any physicians, okay, that you don't know, that you never knew, and try to set up an appointment? And don't tell me just one, it has to be more than 30. And that's just minimum. Okay, have you actually put out mailers? Have you sent out multiple emails? Have you actually done any blogging this week to start getting the word out? Did you post any interesting things in LinkedIn and YouTube and Facebook? What have you done that can generate buzz for people to actually look into you? Being able to market your company and sell them on the notion of referring you patients is critical. How great are you at getting people to refer patients to your agency? If I ask you between a rating of 1 to 10, how good do you think you are to get referrals? Give me a number. Think about it. Most people will say a 7, okay? So if you're a 7, that's great. What can we do to make it an 8? What can we do to make it a 9? If it's below a 7, what actions can you start right now that will slowly improve you and get you to a 7 and then eventually a 9? Nobody should be a 10 because you can always do more than what you're doing. Okay, home health marketers are the reason agencies will survive. That's it. You can have a crappy DON that's easy to be replaced. You can have bad nurses, you can get rid of those and hire them. But a great marketer is what you want. People who want to market the company and become successful. That is what's going to bring you guys success. Don't fool yourself. You need to make sure that you get this in your head. No matter how great your clinical team is, if there is no patients to be taken care of, and then you cannot show how good they are. So you can't prove it. The proof is in the pudding. So before you can start taking care of patients, you better have a good marketing program, a good marketer, and if you don't have one, you need to hire them and have them take this particular training that we're going to. And if you're taking these trainings and to start changing your mindset and getting ideas on what you need to do to improve yourself, to better yourself, that is what's going to make you even better. If you don't have a marketer, I guarantee you your company will fail. Now, of course, if you are the marketer of the company, if you are the administrator, the owner, and you also are the marketer, you cannot expand further if you do not bring another person in for your company. Your marketing team, as long as they are given proper training and provided a great product, will bring you success, and that's guaranteed. And don't just train them in the beginning. You want to train them all throughout. You want to be able to see and find out what are they experiencing, what are the problems that they are facing. Before you start anything that you do, are you going to become an amateur or are you going to become a professional? What I do hope is that anyone that gets into this business, anyone that starts owning their own home health agency, anyone that starts working for a home health agency, wants to learn how to become a professional. Now, in marketing your home health agency, you can either be a professional or amateur. A professional is a person who is engaged and wanting to know more about her or his industry. You have to understand is that you need to be willing to learn new things all the time. Currently, a lot of the new and current marketers are still living in the old ages, thinking that they should be marketing the old ways, not knowing that there are newer things that's been invented, such as social media, SEO, cost per clicks, and a variety of different techniques when you're marketing outside. And typically we think that we just need to do a regular presentation, not thinking about that we should actually be providing persuasion. We need to be able to learn to persuade people to start referring to us. The amateurs, they look at their job as a pastime. They don't look at what they do as their main profession. They are dreaming of the next step. They don't have the knowledge, experience, or competence. And the worst thing is, because they most of the time know that they don't have the knowledge, they don't have the experience or the competence, they do not seek the solutions for this. They feel that someone will give it to them eventually, that someone should just hand it to them, and they're not willing to go out there and take what is theirs. You will find a lot of what we call wannabe marketers. There is a lot of those in this industry, but there is a shortage of really qualified and experienced salespeople and marketers or liaisons, whatever you want to call them. So what are you? What are you looking for if you are looking for a marketer? The difference between mediocrity and greatness is in between your commitment. And you need to create and make that commitment now to be able to become a professional, to be able to learn and want to learn what is going to make you stand out, what is going to be that difference for you to become a successful home health agency. To become a successful home health agency, you must employ people who are like-minded, wanting the success of your company. Let's do quick takeaways. I want you to write down 2 ways you can become a professional in your industry. What do you think, from what we've been doing so far with this whole presentation, this whole training, what 2 ways can you be a professional in your industry? What are the things that I've shared with you that you can actually improve upon and make even better? Now, what are the 3 things that you need to improve on to be a great marketer? If I ask you right now, what do you feel are the weaknesses that you have? We all have weaknesses. I have weaknesses myself, and I always try to make sure that I learn new things to better upon it. What do you think are going to be the 3 biggest things that you need to improve upon when you start marketing for your company? Now, if you don't have a title of marketer, maybe you're a DON or the administrator, or, do you feel that it's not your duty? Well, you have to understand this. It is your duty. Even if you don't have the title of a marketer, you have to understand, okay, that you still are a marketer for the company, just because you don't have the title. Everyone working in your office, from the receptionist, from your clinical staff, from your nurses, from your home health aides, from your caregivers, from your schedulers, from your billers, even your janitors, everyone working for your company needs to be taught the mindset that your company must succeed in order for them to keep their jobs. And for your company to succeed, there should be constant referrals coming into your company, and everyone should partake in helping the success of your company. So the great marketers of home health agencies, you must have the skills of knowing what will happen next. You should be able to learn and predict the results and get to them. You need to be able to make that commitment that you're either all in or you should just get out of the industry completely. Now, what do I talk about prediction? Well, you need to be able to learn and predict what possibly is going to go next. And this is where we learn the different techniques on closing techniques, because everyone is going to give you an objection until you're able to clearly give to them the reason why they should actually do business with you. So you need to be able to be in the part of training yourself. Where, has it ever happened that you've done so well, you've done the job that you've been doing for so long, that something is said or something is done and you tell yourself, I knew that was going to happen. I knew they were going to say that. What I want you to do is I want you to train yourself so good, practice, drill, and rehearse everything, all the different scenarios that could possibly happen in every aspect, not just from marketing, but even for clinical aspects of things, so that when things happen, or you can tell yourself that you predicted this was going to happen. But when you are able to predict and know what may happen, you already have the solutions. The amateur people out there don't even know what problems may occur, and when they occur, they still have to figure out from there what could work or what could be done to be corrected. If you can predict and know what may happen on every single type of scenario and already create a solution for that, that will make it easier for you to succeed as a company and as an organization. Now, before we market our company out there, before we even are able to fully get people to understand that using your services is the right thing, I have to repeat this. You have to sell yourself first. You honestly must be convinced on your product, on your services, on your caregivers, on your employees, everyone that works for you. You need to be all in and convinced that your services are the best before you can actually sell it. Make sure that you believe in the services of your home health agency, your home care company, your hospice agency, whatever services you're offering. You must be first convinced and convince yourself hard enough that this is the best services in the area, or you truly believe that you can provide amazing care. Once you convince yourself that, you can do whatever you want and be able to show the people that you're marketing your company to that they do and they should use your services in your company. Now, if you cannot see it, then you're going to have to force yourself and convince yourself that your company is the best. Now, to make yourself feel better, what can you do to improve your company? Can you make sure that you guys have your meetings to be able to talk about this and to know that your company is a great company, or know that you're willing to improve upon your company to make it even better? Commit to one outcome only: success. Your team of clinicians should come up with the success that you're going to keep the patient on board or make sure that they're taken great care of, avoid any readmission rates. If they're non-medical private duty, to be able to provide the best services possible so that they remain under your company. You need to constantly sell yourself and your team about your product. This is where meetings are important. Not just meetings just to say hello and tell me about the bad things that are happening, but meetings to talk about how can we improve ourselves. Don't just keep on talking about the bad things about your company in these meetings. Talk about how you can improve things. Don't just create up problems, provide the solutions. So let me ask this question. What are you committed to? Are you all the way in now? If you're decided to get into this industry, are you just going to walk in and say, all right, I'm just going to do my part. I'm going to do a little bit just to be better. I'm going to try to do this, try that. Nobody can ever fully do anything if they just say they're going to try. You must either do or not do. Okay, let's talk about private duty and the myth of price. Okay, I want to be able to talk about this. So remember, I've said this several times, that if you're a home health agency accepting Medicare patients and private insurances, and you don't accept non-medical, you better think about accepting non-medical because you're losing a lot of money. Now, if you're a current non-medical company, private duty, be happy that most of these home health agencies are not offering this yet. So I want you guys to think about this. A lot of home health or home care companies think that they should not be expensive, that they should be the lowest price because that is what's going to get people to start using their services. So you'll hear this from me several times. Look, price is a myth. Most private duty agencies and non-medical caregiver agencies believe that the reason they lose a potential client is the price. That is completely false. Successfully getting that client is about the prospect having confidence that the services is the right one for their loved ones, okay? So let me ask you this. What is the difference when people purchase a $75,000 car to a car that's $20,000? They both are driving. They both have wheels. They both have doors. They both have an engine. But why would somebody be able to buy a car that is more expensive? Well, they look at the car as that it's valuable. It's going to give them the feelings of wanting to feel and enjoy a car, rather than typical people who will look at a car as just a transportation device. Same thing where women are willing to pay $1,000 for a bag when the same counterpart of that bag is worth hundreds of dollars, yet it costs the same to make both of them. So typically, it's not just the price. Are we getting what we are paying for? So if you can literally show them that what they're paying for is worth the services that they're getting, then the price is just a complete myth. People buy a product or a service that have advantages in excess of the cost, and because they love the product or it solves a problem, or both. So look, you don't want to be the lowest priced home health agency or home care company, because there can only be one. And the companies that are typically discounting their price too low are not going to remain in this business for a long periods of time. And the reason why is they actually have the same expenses as you will. But if you are charging a little bit higher, then you can cover that with lesser amount of clients. So let's go ahead and do this. Write down 3 examples of times when you bought something you could not afford because it solved a problem, or you loved it so much you had to buy it. This is what you need to do for your agency. You need to provide more services and programs that they will make sense of the cost. So typically, for example, when I provide non-medical services, we provide a menu of services other than a typical caregiver or trip to the store, or we provide, additional, services. What we'll do is we'll do this. We'll tell the company, or we'll tell the potential client for our non-medical services that we offer, emergency alarm systems for the patients. We offer dog grooming. In the Midwest, of course, it snows, so we offer free plowing of the driveway. How many times does it snow during the wintertime? Not as much. So if you're taking care of a client that you've been servicing for a 24-hour service, and you've been taking care of them for the whole year, it makes sense to be able to provide additional services that you can give for free. What other things can you add to your products and services? We also call the patients on a daily basis to be able to remind them to take their medications. This lessens the chances of them having any medication problems. They're being reminded, and we give that for free. We use a service, a company, that we only pay $10 a month for a patient, per patient. And the patient gets called every day at 5 o'clock exactly to remind them to take their medications. Okay? So you have to understand, you have to add more services, more products than the other agency, and it makes sense why you're accepting that type of a payment. So people buy services as long as it solves problems. Remember, you're in the people business. Okay, if you don't believe this, then it's going to be a little bit of a problem. If you haven't figured it out by now, then you need to know this. You are in the people business and not in the product business. If you put profit over people, then you're going the wrong way. Remember, we're not a service-oriented business. We are a problem-solving business. Our job is to solve the problems that our clients are having, or our clients' parents are having. We need to be able to serve them, care for them, take care of them, protect them, give them the necessary needs that they are requesting to be able to keep them comfortable at their home. Ultimately, that's what we do here. We're going to have to create an impact, provide that feeling of comfort and support to ultimately get people to trust us to provide them care continually, so that they're not going to want to transfer to another agency, so they're not going to want to transfer to a different company. You want them to feel secure. You want them to feel safe. You want them to know that your company, your team have their backs continually. And it goes the same exact way on our referral sources. We need to let them know and provide them services so that they know, services in which we are able to solve their problems, so that they know that we will care for their clients the moment they give us a call, the moment that they say, Michael, I have a patient referral for you. I'm doing this. They're doing this because they know you're going to provide outstanding, amazing, perfect care as much as possible. So people who are looking for a solution is what we're doing, okay? What solutions can you solve? So you need to have great communication. Real communication requires questioning on what is important to the people so that you can identify what they actually want and then deliver it. So this is what we do, is when we're talking to people, when we're presenting ourselves, we need to be able to generate questions that needs to be able to be answered or asked by themselves internally, or to be able to provide it outside, to be able to give it to you. What questions can you ask them that you can actually initiate for them to start to begin to think on the problems that they're solving? So this is where our closing techniques are very important. You want to be able to ask those questions from you can ask them currently right now with what you're facing right now, what problems can be solved for your current home health agencies? Are there any problems that have been occurring continuously with the different home health agencies that you have been servicing? What would make it better for them to be able to start caring for your patients? Let me ask this question. Your mom, how many times have she had a fall? with those incidences, what could have been done to prevent them from falling. Find the questions for them to ask themselves and give you an answer. And then the answers that they give you, you can use that to present your company, your products, your services that can solve the problems that they are facing. Remember, we need to be able to look into the problems. And to be able to find out the problems, we should either know the top 3 problems that always occurs, or at the same time, just ask the question the right way and generate your presentation from there. It is important to be an expert of your services and your products. Before this, you must be an expert with people. So why is that? You see the question? Why is it? Why is it that you need to be an expert? Because you need to know what they are needing. You can't try to push to everyone what you feel that they should be using or what you feel that they should be doing. You need to be able to make them determine that there is a problem that they need. You need to learn the techniques and learning how to communicate properly. We actually have a full 2-hour training that will work with you in regards to your body language and communication techniques, because this is very important to us to be able to have, is to be able to provide communication techniques for you, because that is what is needed right there. So understand that selling is 80% people and 20% product. What that means literally is, look, most of the time it's not the services that you have, it's not the product, it's not the item you're selling, it's you who sells the product. How many times have you bought something of inferior value, of inferior, reliability to another product? One good example is this, is a lot of times people have purchased what? Windows-based computers, when everybody knows that Apple-based computers are better, right? So why did you choose a Windows-based computer? Well, most of the time it's because that's what everybody around you is using. That's what you've been using for a long period of time. So the question is, how can you break that mold? How can you break that, that habit that a person is doing? You want to be able to break those habits in order to be able to get them to start using your services. And that's where presentations are important. That's where persuasion and communication techniques are very important. Let me ask this question. Most of the time, typically, people actually communicate with words. But did you know that in studies, are you aware of this? That in studies, words are only 7% of communication. The rest is physiology, okay? And the rest is how you actually say the words, and the rest is body language. Nonverbal communication is the rest. So 7% words, and the rest is nonverbal, which is 97%. And you need to be able to understand and learn that this is a way to be able to actually communicate properly. And that is very important to know. So pretty much what I'm trying to say is you need to make sure you're an expert at what you do. If you're a marketer and you're marketing your home health services, know everything about home health care. Know everything that home health services can benefit. Know what you can do to benefit and help the referral sources, especially their patients. These are the things that you need to know. And what we're doing here is being able to educate you how to market your company and also what services that you should actually apply. But also make sure you study and learn everything on what the coverages are, how it can be paid for, how you can make sure that the patient, the client, can benefit from the services that you are providing.